Good morning, children. In today's session, I am going to take class for 7th standard science, health and hygiene, lesson 6. And we are going to continue the class now. So in the last class, we saw about the communicable disease caused by bacteria. Now we are going to see disease caused by virus. Disease caused by virus. Okay, children. Now viral disease are extremely widespread infections caused by many type of viruses. Some disease caused by viruses are hepatitis, chickenpox and rabies. So these are the viral diseases, that is hepatitis, chickenpox and the rabies. Now first we are going to see the hepatitis. Hepatitis. Now first, hepatitis is one of the most dangerous and the fatal, that is fatal means that is ending in death. Okay, ending in death, that is death disease caused by hepatitis virus A, B, C, D and B. So what are the hepatitis virus? A, B, C, D and E. So these are the hepatitis virus. Its mode of transmission is this, that is from one to another. Transmission is contaminated water. So it's transmitted from contaminated water. Sharing of needles, that is put injection powder only, that is sharing of needles, and blood transfusion, that is we are giving the blood. So blood transfusion. So the symptoms of, so what are the mode of transmission is? Transmission is through contaminated water, sharing of needles and blood transfusion. Okay, children, and blood transfusion. Okay, so this. Now what are the symptoms you can see? The symptoms you can see is hepatitis, a loss of appetite. So anorexia is a loss of body weight. That is loss of appetite or anorexia. Okay, what did I say for anorexia in the last class? That is loss of body weight and vomiting. Eyes and urine turning to yellow color. Okay, children, these are the symptoms of hepatitis. Okay. So that is hepatitis, what is caused by the virus? A, B, C, D and E. What are the mode of transmission? Transmission is transmitted through contaminated water, sharing of needles and blood transfusion, children. Then symptoms, what are the symptoms for the loss of appetite or anorexia I said. Then vomiting, eyes and urine becoming yellow color. Okay. Now what are the prevention and treatment for these children? That is same, drinking boiled water, proper cleaning of hands. So you should clean your hands regularly and you have to drink boiled water. Okay, children. Next we will go to the chickenpox. So did you understand this, children? Now we are going to see the chickenpox now. Now chickenpox is also known as varicella. Okay, it is also known as a varicella. Chickenpox is also known as varicella. Is highly contagious infection caused by the varicella zoster virus. So why this given varicella name, children? Because of the varicella zoster virus. Okay, children, because of this virus only it's given another name as varicella. Now the disease spreads through air on contact with an infected person. How did it spread? It spreads through air and with the infected person. It can spread through air or through infected person. Okay, children. Now what are the symptoms? Symptoms are the appearance of rashes on the whole body, that is allergy on the whole body. Rashes on the whole body and fever, headache and tiredness. Okay, children. So these are the symptoms for the chickenpox. So chickenpox is otherwise called as a varicella. So how did it get the name? It gets caused by the varicella zoster virus. Then how it spreads? It spreads through air or through infected person. Then what are the symptoms here? Rashes on the whole body, fever, headache and the tiredness. Tired means sore tiredness. And what is the prevention and treatment? The chickenpox, that is otherwise known as varicella vaccine, is the best way to prevent chickenpox. A vaccine is given for this, and the special attention should be given to this infected persons. Okay, children. And next we'll go to the rabies. Next is the, so did you understand the chickenpox now? Next we are going to go to the rabies. Next is the rabies. So rabies is a fatal disease, that is, already said fatal means what? Which leads to death. Fatal disease which is transmitted by the bite of the infected dog. Infected, that's a disease dog. When they bite, this rabies is infected to us, okay? Dog, rabbit and monkey, cat also. Rabbit, monkey, cat, etc. So, when these disease animals bite us, we are infected by the disease called rabies. The virus present in the saliva of dog enters the brain via neurons. Okay, so what happens? The saliva which they use, the dog has, when they bite it, where it goes? It enters the brain. Enters the brain through neurons. Okay, then the symptoms of rabies are hydrophobia. What are the symptoms? Hydrophobia, that is extreme fear for water, fever for 2 to 12 weeks, and exaggerations in behavior. Exaggeration means you may get better or may get even worse also. Okay, these are the exaggerations in the behavior. That is fever, then exaggerations in the behavior. Exaggerations means what I said, children, that is you may get better or may get even worse also. So these are the exaggerations in their behavior. So rabies, how did it get? Bite of the infected dog, rabbit, monkey or cat. Okay. Then how it enters? After it infects us, it enters straightly into our brain through neurons. Okay, children. Then hydrophobia, fever and exaggerations in the behavior are the symptoms for this rabies. Now what is the prevention and treatment? In early stages, rabies is very difficult to detect. So on the olden days, so on the early stages, it's very difficult to detect in the early stages. So நம்ம வந்து கடிச்சாலும் நமக்கு அது தெரியாது. அது கடிச்சறப்போ நமக்கு வந்து அதோட டிஃபெக்ட் எதுவும் தெரியாது நமக்கு. But after an animal is bitten, it usually takes 2 or 12 weeks. Okay, அது வந்து கடிக்கிறப்போ நமக்கு அதோட எஃபெக்ட் தெரியாது. ஆனா ஒரு 2 வாரத்துக்குமோ இல்ல 2 வருஷத்துக்கு அப்புறமோ it takes 2 or 12 weeks to show any symptoms, and it may take as long as 2 years also. Okay, and the symptoms நம்ம காமிக்கிறதுக்கு 2 days கூட எடுக்கலாம், 2 weeks, 12 weeks கூட எடுக்கலாம், 2 years கூட எடுக்கலாம். புரியுதா? To show the symptoms. Fatality means death. Okay, can be prevented by timely vaccination. So அது நமக்கு என்ன பண்ணா, அது நமக்கு அந்த டிசீஸ் நமக்கு வரக்கூடாதுன்னு சொல்லிட்டு இப்படி நமக்கு நாய் ஏதாவது கடிச்சதுன்னா நம்ம உடனே போய் என்ன பண்ணோம், அதோட வேக்சினேஷன் போட்டுக்கணும். Because it should be vaccinated, it may lead to death also. Okay, so as soon as any animal bites us, we have to take vaccination. Okay, so to avoid the fatality can be prevented by timely vaccination before the onset of symptoms. Okay, children. Next is the vaccine given here. A vaccine is a biological preparation that provides active acquired immunity to a particular disease. So, immunity given to a particular disease. Vaccines like BCG, polio, MMR are given to early childhood. Early childhood, when you are young itself, it is given. When in the childhood itself, this vaccination is given to protect from you from this diseases. Okay, children. Now, see this picture is given here. That is virus entering via animal bite. So, this dog is biting this man. First point given, a virus enters via animal bite. Second point is, virus replicates in the muscle at site of bite. So where does it go now? It goes to the muscles. Then virus infects nerves. Okay, next what happens? It affects the nerves in the peripheral nervous system, moves by retrograde transport. Now it moves to other places. Then virus replicates in dorsal root ganglion and travels up spinal cord to brain. Okay, it moves into nerves and moves to the spinal cord, and straight where it goes, it moves to the brain. Then brain is infected now. Okay, then virus travels from brain via nerves to other tissues. Again it moves to the nerves and other to the tissues such as eye, kidney, salivary glands. Okay, so it leads to death. Okay, children, like if you see the picture, you can understand how does it moves. Then next we'll go to the non-communicable diseases. Now we saw communicable disease caused by bacteria and virus. Now we are going to see the non-communicable disease. Okay, children. Communicable, I said that disease spread from one person to another person is a communicable. Now we are going to see the non-communicable diseases which does not spread through one person to another person. That is, non-communicable person's disease do not spread from person to person like communicable. They are caused by other factors. That is, it is important to know which diseases are communicable and which are not. They are never caused by germs, bacteria or other living organism that infect the body. So this non-communicable disease are not caused by any germs or bacteria. Then antibiotics or medicines that fight against germs do not help to cure non-communicable diseases. So antibiotics or medicines does not help to cure non-communicable diseases. Some of the non-communicable diseases are explained below. That is wearing out of body parts. Okay, first is the wearing out of body parts. Wearing out of body parts is the first one. Rheumatism. Rheumatism is nothing but the pain in the joints and the muscles. Okay, children, pain in the joints and muscles are called as a rheumatism. Heart attack. Epileptic seizures. Epileptic seizures means that is nervous disorder, that is brain becomes abnormal. Okay, epileptic seizures means that is nervous system disorder, it affects the brains is abnormal. Then stroke. Then migraine headache, that is one side headache. Okay, migraine means one side headache. Cataract that is affects the eyes, and cancer. So these are the wearing out of body parts. Now external harmful agents entering the body, that is external harmful agents that entering the body, that is which goes inside the body, that is harmful agents like allergies, you know allergies, that is rashes on the body, asthma, that is difficult to breathe. Okay, then poisons, snake bite, cough from smoking, that is smoking but cough varudilla. Then stomach ulcer and alcoholism, that is drinking, alcoholism. These you get the external harmful, that is from the outside. External means outside harmful agents that entering our body. So these some of these. Next is the lack of trace elements in the body. Lack of trace elements, lack of trace elements in the body, that is anemia, you know, that is lack of blood, like okay, lack of blood cells. Then pellagra is lack of, that is diarrhea or inflamed skin, that is pellagra. Then night blindness, that is cannot see in the night, that is night blindness. Xerophthalmia is a eye disease because of the vitamin A deficiency. Then goiter is a abnormal with enlargement, we can see below the thyroid. Okay, you can see this goiter means you get a this one enlarged one that is below the thyroid. And hypothyroidism is this thyroid gland which does not produce thyroid hormones, that is called as a hypothyroidism, that is thyroid gland which does not produce a thyroid hormone. So these are the lack of trace elements in the body. So first we saw the wearing out of the body parts, that is rheumatism. Rheumatism, what I said, that is pain in the joints and the muscles. Then heart attack. Then epileptic seizures, nothing but the nervous system disorder, that is brain becomes abnormal. Then stroke. Then migraine headache is at one side headache, cataract and cancer. Next is the external harmful agents, that is moves inside the body, is allergy, asthma, poisons which goes inside, snake bite, cough from smoking, stomach ulcer and alcoholism. I said that is drinking. The lack of trace elements in the body like anemia, that is lack of blood. Then pellagra, that is diarrhea and inflamed skin. Night blindness, that after 6 o'clock we cannot see the eyes. Then xerophthalmia, that is eye disease because of the vitamin A deficiency. And goiter, that is abnormal enlargement below our thyroid, that is called as a goiter. And the hypothyroidism, that is thyroid gland which does not produce the thyroid hormones. These are the trace elements, lack of elements in the body. Next is malnutrition. Next is the malnutrition. Okay children, that's malnutrition is nothing but the poor diet. The body does not get enough nutrient, that is called as a poor diet. Nutritious food is needed for a person to grow well, work hard and stay healthy. So malnutrition is nothing, that's a poor diet if you do not get enough nutrients to your body. Because if you get a person to grow well, work hard and stay healthy. Many common sickness are caused by the malnutrition. So because of this malnutrition you get many sickness. Then do you know, see here, leukoderma is a non-communicable disease. Leukoderma is a non-communicable disease caused by partial or total loss of pigmentation in the skin. Loss of pigmentation, that is melanin pigment. In the skin you have a melanin pigment. Because of this loss of melanin pigment in the skin. And this condition affects people of any age, gender and ethnicity. There is no cure for this disease. It does not spread by touching, sharing food or sitting together. So it's a non-communicable disease that it does not spread through anything. Okay. Next is specific health problems of children. First is anemia. Anemia means what I said, children, that is lack of blood in your body. It is caused by eating food with less iron content, and it can also be caused due to feeding some other food instead of breast milk. Okay. Severe anemia in children may lead to hookworm infection, that is infection in the intestine, that is the hookworm infection, chronic diarrhea, chronic that is continuous diarrhea, and dysentery. In the recent days, school-going children, especially girls, are affected by this anemia. The government of Tamil Nadu provides iron folic tablet, that is to prevent the lack of these nutrients. They have given iron folic tablets to all the girls in the school of all areas every week. So to prevent this lack of nutrients, they are given this iron folic tablets. Next, the signs of anemia. So if you have anemia, what are the signs in your body you can see? That is pale or transparent skin. So your skin will be pale. அப்படியே white-ஆ இருப்பீங்க பார்க்கிறதுக்கு. The inner scale surface of eyelids are pale. இந்த eyelids வந்து நீங்க இது பண்ணி பார்த்தீங்கன்னா it will be pale, blood இருக்காது. White fingernails. Your fingernails should be white. And pale gums. Weakness, you'll be weak. And fatigue. Fatigue means tired. Okay, fatigue means what? Tired. So what are the signs of anemia? You have pale skin and your eyelids will be pale and the white fingernails, then pale gums, you'll be weak and you'll be tired. All these signs show that you have a lack of blood in your body. So if you have like that, you can tell it to your parents, okay? And they can take the enough prevention and treatment they can give for that, okay children? And in severe case, face and feet may be swollen. அது இன்னும் severe ஆயிடுச்சுன்னா உங்களோட அனிமிக் இது வந்து if you get more severe, what happens? Your face and feet may be swollen. Swollenனா வீங்கி இருக்கும். Then the heartbeat is rapid and with shortness of breath. உங்களோட heartbeat வந்து ஜாஸ்தி ஆகும் and the shortness of breathing வந்து உங்களுக்கு shortness இருக்கும், கம்மியாகும். புரியுதா? Then children, women who eat mud. Mud means மண்ணுன்னு சொல்றேன் இல்லையா? Are usually anemic. So some may eat mud and these usually children and women who eat mud are usually anemic. So what are the signs I said, children? So that is pale skin, inner surface of your eyelid will be pale, white fingernails, pale gums, you will be weak and tired also. Then in severe cases, severe ஆயிடுச்சுனா your face and the feet may be swollen. Swollen means வீங்கி இருக்கிறது. And the heartbeat will be rapid and the shortness of your breath. Then children and women who eat mud are usually anemic. Okay children, did you understand now? And the treatment and prevention of anemia. So what is the treatment given for this? Anemia can be preventing by takes of proper food and proper diet. Okay, so if you take proper food and diet, this anemia you can avoid this. Okay, this can be prevented. Then food, what you have is moringa leaves, that is drumstick. Okay, moringa kira. Then dates, liver of sheep and chicken. Okay, this you can. Then green leafy vegetables like beans, whatever is green vegetables, peas, lentils pairin solraniya, and green banana. So all this food you can eat. Then pills, what are the tablets you have to take? Cod liver oil tablet and ferrous sulfate. These are the prevention and the treatment of the anemia. Next is the safety and first aid. So first aid is the immediate treatment given to the victim of trauma. Trauma means injury or sudden illness before medical help is made available. So before going to the doctor, this first aid is given. Is the immediate treatment given to the victim. Okay. Then first aid is important for following reasons. First aid, what it should be given before going to the doctor. First point, it saves a life. So what is the first aid important? That is, it saves a life. It saves a life. Next is prevents bleeding. Bleeding na ratham kottom illaya, prevents bleeding and determine the condition of the patient. It relieves the pain. Pain kammi agum sariya, and provides a medical care available to the earliest. So medical care available to the earliest. Okay children, medical care. So it saves the life, prevents bleeding, relieves the pain and available to the earliest. That is the first aid given. Then next is burns. Burns na the tissue damage caused by heat, chemical, electricity, sunlight or nuclear radiation is known as burns. So the tissue damage caused by heat, unga body la the tissue damage agumbodhu eppadi heat ala, or either chemical or any electricity, sunlight or nuclear radiation is known as the burns. Mostly burns are caused by scalds. Scalds means a very hot liquid. புரியுதா? ஏதாவது ஒரு ஹாட் ஏதாவது இருந்துச்சுன்னா அது விழுந்துச்சுன்னா அது என்ன ஆகும், நமக்கு burns ஏற்படுது. Then building fires. Buildingலலாம் fire ஆகும் இல்லையா, fire in the buildings. Then flammable liquid and gases, that is இப்போ சிலிண்டர்லாம் வெடிச்சதுன்னா அதெல்லாம் ஆகுது இல்லையா அது. Then there are 3 types of burns according to the degree of burning. First degree burns affects only the outer layer of the skin. So first degree is affecting the first layer, that is outer layer, called the epidermis of the skin. You can see in this picture, children, those who have the book, those who don't have the book, you can see here. That is second degree is burns damage the epidermis and the layer beneath it, called the dermis, or the inside. First degree வந்து epidermis மட்டும், outer layer. Second degree வந்து இன்னும் உள்ள போகும், that is second degree called the layer beneath it, இல்லைன்னா அதுக்குள்ள, that is called the dermis. The third degree burns involved damage or complete destruction of the skin. Third degree வந்து இன்னும் ரொம்ப severe இருக்கும், that is complete damage of the skin to its full depth நல்லா உள்ள போய், and damage to underlying tissues also. People who experience such burns often require skin grafting. Skin grafting is surgery, okay? That is removing skin from one area of the body and removing or transplanting it to another part of the body. புரியுதா? இப்போ நம்ம பாடியிலேருந்து ஃபார் எக்ஸாம்பிள் இப்போ நம்ம கை எரிஞ்சதுன்னா நம்ம என்ன பண்ணுவோம், கால்லேருந்து அந்த ஸ்கின் எடுத்து அவங்க என்ன பண்ணுவாங்க, கைக்கு போடுவாங்க. அந்த மாதிரி that is moving or transplanting it to another part of our body. That is called as a skin grafting. Okay children, what is the first degree I said? That is outer layer of the skin area. Second degree வந்து இன்னும் கொஞ்சம் உள்ள, that is beneath, that is called as the dermis. Third degree வந்து இன்னும் severe affect ஆகுது, that is damages fully a part of the skin. So அப்படி ஆறவங்களுக்கு அவங்களுக்கு என்ன பண்ணணும், skin grafting should be done, that is actual surgery. That is removing the skin from one area of the body and transplanting it to another part of the body. Okay children, next is first aid of burning. So burning க்கு நம்ம என்ன first aid கொடுக்கணும். In case of minor burns, minorனா கொஞ்சமா burn ஆயிருந்துச்சுன்னா, the affected area should be washed with cold water and antiseptic cream should be applied. So light-ஆ நமக்கு burn ஆச்சுன்னா நம்ம என்ன பண்ணுவோம், அதில் நல்லா we have to wash it with cold water and have to apply the antiseptic cream. In case of severe இருந்துச்சுன்னா, the deeper layer of tissues get destroyed and blistersனா bubbles மாதிரி appear. Use of water should be avoided. அந்த தண்ணி படிச்சுன்னா இன்னும் என்ன ஆகும், சிவியர் ஆகிடும். So we should avoid the water. Then the burnt area should be covered with a clean non-sticking cloth or bandage. It should be covered with a bandage. Larger burns need immediate medical attention. இன்னும் ரொம்ப சிவியராக burns இருந்துச்சுன்னா they should need immediate attention. It's very important to keep a fire extinguisher readily available. Fire extinguisher அந்த ஃபயர் வந்து இது பண்ணுறதுக்காக அவாய்ட் பண்ணுறதுக்காக யூஸ் பண்ணுறாங்க இல்லையா, ஃபயர் எக்ஸ்டிங்விஷர். தென் கட் அண்ட் ஸ்க்ராச்சஸ். கட்ஸ்னால் உங்களுக்கு என்ன தெரியும், அப்படியே கட் ஆகுது. ஸ்க்ராச்சஸ் உங்களுக்கு கீழே இல்லாத விழுந்து ஸ்க்ராச்சஸ் வருதுன்னு அதான கட் அண்ட் ஸ்க்ராச்சஸ். Cut and scratches are the areas of damage on the surface of the skin, that is outer layer of the skin. The cut is a line of damage that can go through the skin and into the muscle tissues below. There is a scratch is surface damage that does not penetrate the lower tissues. அதாவது கட் வந்து ஒரு இப்போ நம்ம ஃபார் எக்ஸாம்பிள் we are cutting the vegetable. When we are cutting the vegetable, the knife என்ன ஆகுது, நமக்கு வந்து கட் ஆகிடுது. அப்போனா வந்து உள்ள வரைக்கும் அது போகுது, டிஷ்யூஸ் தெரியுது இல்லையா. ஸோ தட் இஸ் கட். ஸ்க்ராட்ச்னால் நமக்கு மேலேயே அவுட்டர் ஆஃப் ஸ்கின், இப்போ நம்ம ஓடி போகிறோம் விழுந்துடும், இப்போ என்ன ஆகுது, நமக்கு ஸ்க்ராச்சஸ் மட்டும்தான், தட் இஸ் அவுட்டர் லேயர் ஆஃப் த ஸ்கின். So cuts and scratches may bleed or turn red, become infected and leave scars. அதாவது cut and scratches வந்து என்ன ஆகும், bleed ஆகும்னா அது ரத்தம் வரும். And what happens, it turns red. அப்புறம் போக போக என்ன ஆகும், it's infected and the scars அப்படியே இருக்கும். அது நம்ம விழுந்தோம், இப்போ நம்ம ஃபார் எக்ஸாம்பிள் இப்போ ஒரு 5 years விழுந்தோன்னா அது அப்படியே அடிப்பட்டுச்சுன்னா 10 yearsல கூட அந்த ஸ்கார் நம்ம அந்த இது இருக்கும் அப்படியே. ஸோ அந்த ஸ்கார் இருந்துச்சுன்னா நம்ம சொல்லலாம் நம்ம இப்போ இந்த விழுந்தோம் அதனால இந்த ஸ்கார் இருக்குது இல்லையா. Then first aid for cuts. So for minor cuts, the affected area should be washed. So minor cuts na chinna cuts, adukku vandu the affected area should be washed with cold running water and cleaned with an antiseptic liquid. Na enna sonna nanu, it should be cleaned with the cold running water and it should be cleaned with an antiseptic liquid. Then an antiseptic cream should be applied on the wound. Enga adipatticho, it should be applied and sterilized bandage, adhaadu apply panni enna panna bandage pote should be tied to prevent infection. If the cut is deep, ரொம்ப ஆழமா போச்சுன்னா கட் என்ன பண்ணணும், a clean cotton pad should be placed on the cut and pressed. அந்த காட்டன் எடுத்து என்ன பண்ணணும், அதை press பண்ணி, and the injured person should be taken to a doctor immediately if the cut is deep. Okay children, the injured person should be taken to the doctor immediately. Now basic cleanliness and protection. So the most important thing is to help anybody but you must also protect yourself from HIV and other bloodborne diseases when you help someone who is bleeding. So when you're helping someone who is bleeding, you should also be careful and protect yourself from the HIV and other bloodborne diseases. So be careful when you help others' children. So you should wear gloves or clean plastic bag on your hands. So be careful not to prick yourself with needles or other sharp objects around the person you are helping. So when you are helping, should be careful not to prick with your needles or other sharp objects. So you should be careful, children. So with this we are finishing the lessons, children. We saw communicable disease, non-communicable disease we saw. Then we saw the specific health problems of the children, that is anemia. What are the signs of anemia and what you have to do for the prevention and what treatment should be given for that. And safety and first aid, that is burns we saw, first aid for the burning and cuts and scratches, and first aid what should be given for that. I think you have understood this lesson, children. So in the next class we'll start with the new lesson, children. Thank you.